Hello, my name is Brenna Macmillan, and this is my change project proposal. Identifying the issue. So, in my job in the OR, the current issue that I have is we don't get paid enough for what we do. We come in at 6:30 in the morning, and we often work until midnight, sometimes 2 a.m. or later, and we get incentive money, but it's really not worth the amount of hours that we're there. We also have a high turnover rate for nurses and scrubs because of this, and so really the issue is we have not enough pay for the amount of hours we work, and we're not able to retain our staff. Um, so for efficiency and effectiveness, if we improved these issues, people would be happier, they'd be well rested and eager to come to work and do what they used to love to do. We would perform more efficiently and want to be more effective and work harder due to the being more rested. We would have better financial outcomes for the hospital because we wouldn't keep losing trained staff members and have the need to hire new people from the outside of the hospital and give them these sign-on bonuses. Some ethical concerns with, I think we have ethical concerns with letting staff work from 6:30 in the morning until 2 the next day, 2 a.m. the next morning. I personally just think that should be illegal. We're tired, and that's just very unsafe patient care in my mind. Causes fatigue on the whole staff and raises concern for patient safety. My general stakeholder analysis. Um, let's see. There's the people that are impacted the most from this are the nurses and the scrubs. Neurosurgery doesn't have a night shift, so the ones that come in the morning are required to stay until the doctors are done at whatever time it takes. The patients are affected by the long hours because they come to the hospital in the pre-op area early in the morning or, later in the afternoon, and their surgery often doesn't start until 10 p.m. or later, and they really don't know how long it's going to take either. Um, the surgeon and the PA, I would say, are also impacted by long hours. The terms of power, influence, and impact. The surgeon has the highest power and influence because they're the ones performing the surgery and basically leading the show. They also have the final word in all the clinical decision making. The physician assistant or nurse practitioner, they have moderate power and influence because they sort of act as like the middleman between the surgeon and the rest of the team, the nurses and the scrubs. The nurses don't have the highest power, but we have pretty high influence. Um, we like to say that we run the room. We, like the circulators, we're responsible for communicating plans and always ensuring that the patient is safe. We always have high impact because we coordinate the workflow, is what I would say. The scrubs have moderate influence and high impact because of their knowledge of all the instruments and procedures. They know the surgeon so well and they know exactly what they're going to need and when they're going to need it. Um, I decided to do a root cause analysis in the 5 whys. I've got why are the nurses and scrubs working long hours and low pay? Because the surgical procedures are going past our scheduled shift and we don't have night shift staff in neurosurgery. Second why is why don't the night shift nurses in the OR that we already have cover neurosurgery? Probably because the hospital doesn't want to hire extra night shift nurses and would rather just let the neuro staff stay late. And the current night shift nurses aren't trained for neurosurgery. Why won't the hospital let the night shift cover neurosurgery to prevent burnout and overtime? Because we're getting lots of overtime and we're very burnt out. Because hiring more staff would cost the hospital more money due to the sign-on bonuses and the costs that go into training new people. Why is the hospital budget so tight that it can't afford to pay the current staff what they deserve? Because the hospital would rather have a higher revenue than having higher wages for the staff. My last why is, why does the hospital revenue take prioritization over the employee's well-being? The hospital prioritizes profit over staff retention. My collaborative team members that I discussed this issue with is they're my coworkers, Parker Howard. She's a BSN prepared nurse, and then one of our scrub techs in neurosurgery, Brittany Heitmuller. Now I'm going to discuss the 7 stages in the role of change agent from the textbook. And then, so the first one is developing a need for change. You have to identify the problem and communicate the need for better working conditions. Number 2 is disseminating information. You would collaborate with team members about the current issues, which are low pay and long hours. 3, identifying the problem, communicating how we are underpaid for our 16+ hour shifts. Number 4, developing the client's intent to change. We need to discuss with the patients the schedule delays and changes that are happening to the schedule and ask them if they're okay um, waiting longer for their surgery or if they would rather postpone so they're not sitting there in the hospital all day just waiting around hungry. Number 5, translating intent into action, hiring night shift nurses for neurosurgery. 6, hardwiring adoption and preventing non-compliance. Officially hire more night shift nurses and continue receiving feedback from the adopted changes. 7, achieving termination/adjournment. Recognize that the bringing on of new night shift nurses has helped with staff burnout and retention. So, me and Brittany and Parker brainstormed together and thought of ways to improve this clinical issue. And we talked about how we wish there was a night shift staff that would cover neurosurgery. The current night shift staff that comes in only covers general surgery, ortho trauma, and vascular surgery. So the current staff in neuro, the nurses and scrubs, have to stay until the surgeon is finished, which can be anywhere from 8 p.m. to 4 a.m. It just depends on the day and what's going on. For evidence-based literature to inform my team how others may have used successful means of change. One of the articles I found discussed the benefits of shift work and how it can decrease burnout. Then it discussed a flexible scheduling method and how it creates more flexibility by allowing team members to have time off after working late past their normally scheduled hours. So that would be like, you stay till 2 in the morning and then your boss says, okay, we don't need you till noon the next day. The second article I found was written by a clinical nurse specialist. She discussed how having extra help on your shift can increase morale and help with turnover rates. All of this can empower the staff and help people work more efficiently, which can reduce the need to stay late. Identify how the clinical issue will be improved. Hiring more staff members for neurosurgery will help improve the issue of long hours, specifically night shift nurses and scrubs. Our normal hours are 6:30 a.m. to 7 p.m. 3 days a week. So if we could just have someone to take over at 7 p.m., I think that would make a drastic difference. The main goal is to prevent burnout of the staff, but most importantly, to protect the patients. If we stay at work until midnight or later and our surgeons have cases at 7 a.m. the next day, we're still expected to come to work in the morning. This makes us really tired and, in my opinion, is very unsafe for the patients because if you're not getting enough sleep, you're not thinking clearly, and it might be easier for you to make mistakes to the patients. For my SMART objective, for my desired change, I put by the end of next summer, my nursing coordinator in the operating room will hire 4 new nurses and 4 new scrubs to reduce each person's shift to no more than 12 hours. This will drastically improve the nurse fatigue and improve patient safety. So I did a force field analysis for my desired change. I've got my driving forces and my restraining forces. The driving force is nurse and scrub burnout. The restraining force is budget constraints. The next driving force is high turnover of nurses and scrubs. And the restraining force to that is superiors resisting change. The next one is patient safety concerns. That restraining force is staffing shortages. And then the next driving force is support from staff. And that restraining force is surgeons' resistance to change. If I tried to propose my idea to administration and I got resistance, I would go do some research and find evidence that shows how hiring additional staff can decrease burnout. I know that sounds like common sense, but clearly having such high turnover rates, something needs to be changed because people don't leave places that they feel happy. I decided to go with um, I almost skipped a section for determining strategies to motivate others to adopt the change. Um, I really don't think it would be that difficult because most of the people in my department we already want change. But if there was someone I needed to motivate, I would probably just discuss how leaving work on time would give us more time at home to spend with our friends or family or just, do our favorite hobbies. Next, I decided to discuss Lewin's change theory. Lewin's change theory has a three-step process. It's unfreezing, moving, and refreezing. Our textbook says that unfreezing creates an awareness of the need for change. For this step, I would just discuss with management about how the current staffing creates nurse and scrub fatigue and it impacts patient safety. For the second stage, moving, I would recommend a trial run with the night shift crew in neurosurgery. Maybe I would just use the current night shift staff or the PRN as needed nurses in neuro. For the um, for the refreezing stage, I would show the improvements in the department with decreased fatigue and decreased error rates. So how I will implement the desired change, I'm going to ask my manager to have a meeting with me and um, the nurse manager over all the departments and all the directors. I'm going to discuss how many of us are working well past our shifts and well after our shifts are supposed to end. It's creating burnout and severe fatigue on all the nurses and scrubs, and I'm worried that we're putting our patients at risk. I'll discuss how a way to resolve this issue. Um, I'm going to propose a designated night shift crew that does not involve our regular day shift staff. I feel that we need to hire 4 more nurses and 4 more scrubs to help rotate and cover the surgical cases throughout the night. And remember, it's also a patient safety issue. It's not just us wanting to go home. If my plan works, and it helps improve nurse fatigue, I want to make this change permanent. We'll try it for a few weeks and obtain feedback from all the neuro staff and see how everyone else feels about the change. So, briefly discuss how to influence those around you to adopt the change. The innovators are the ones that are ready for change just as much as I am. So I'll bring my plan to them first. Um, I want to allow the early adopters to give feedback during the trial run. Once I have some positive results to share, I'll have my early majority because they will want to see evidence of success. Then, after I get my early majority, I'll have my late majority because they'll follow the early majority. Then I'll approach the laggards and hear out their concerns and show them how the new night shift creates a positive change. So for monitoring progress, I briefly discussed this earlier, but I think the best way to monitor progress would be to just ask everyone for their feedback and see if they're any happier overall. Also, you can look at the recorded patient safety events or near misses and see if anything like that has been decreased. Let's see, for service benefits that can be measured, we have input, process, output, and quantity or quality. For input, I said I would say hiring more nurses and scrubs is more efficient. It helps us use our time more efficiently. For process, we're processing things with the extra help. And output, quality outputs have changed for the better. Staff well-being has improved and patient safety has improved. And then quality service has also improved due to nurses having a better well-being. Patients' experience has also improved due to better outcomes. So to reflect back on everything, overall the issue is just we're working way too long and not getting paid enough for it. And again, a patient safety issue. Um, I think implementing a new night shift staff, just if 4 more nurses and 4 more scrubs overall, I think that would help. With the burnout and patient safety issues, I think we would be more rested, not having to stay super late and, late into the next morning and then be back at work just a few hours after that. I think having extra people would help take some of the load off. Um, to see if anyone else agrees, I would obtain feedback from all my staff and see what everyone else thinks and see if everyone else is happy.